Grateful to welcome you all to the commencement of this guest lecture. I, Dr. Nusrat, feel extremely privileged to open this event and stand here. I am extremely pleased to welcome those who have joined us for the occasion. A very special welcome to all our dignitaries who truly have set a benchmark for multi-hyphenated achievements. I am certain that you all are eager and anxious. Let's begin the event. I request Mrs. Suma, R&D Cell, Sri Devaraja's Academy of Higher Education and Research, to add glory to the event with an invocation song. Shambho, Shiva Shambho, Swayambho, Bho, Shambho, Shiva Shambho, Swayambho, Gangadhara Shankara, Karuna Kara, Mama Baba Sagara, Tharaka, Gangadhara Shankara, Karuna Kara, Mama Baba Sagara, Taraka, Bho, Shambho, Shiva Shambho, Swayambho, Nirguna Parabrahma Swarupa, Gama Gama Bhuta, Prapancha Rahita, Nirguna Parabrahma Swarupa, Gama Gama Bhuta, Prapancha Rahita, Nija Guna Nihita, Nidananda Nanda, Nija Guna Nihita, Nidananda Nanda, Ananda Atishaya Akshaya Linga, Ananda Atishaya Akshaya Linga, Bho, Shambho, Shiva Shambho, Swayambho, Shiva Shambho, Swayambho, Shiva Shambho, Swayambho. Thank you. Thank you, Mrs. Suma. Now, I request all the dignitaries to occupy the dais.
Please tell the names of who are all the dignitaries here.
I am going to invite Dr. C.V. Raghuveer, Honorable Pro-Chancellor, Sri Devaraja's Academy of Higher Education and Research, to occupy the dais. Now, I request Dr. G. Pradeep Kumar, Honorable Vice Chancellor, Sri Devaraja's Academy of Higher Education and Research, to occupy the dais. I request Dr. Prashant A.S., Principal of Ayurveda Mahavidyalaya, Hubli, Karnataka, to occupy the dais. I request Mrs. Aki Nikuda, CEO, Eye Wellness Company, Tokyo, Japan, to occupy the dais. I request Dr. P. Sriramulu, Principal, Sri Devaraja's Academy of Higher Education and Research, to occupy the dais. Now I request Dr. C.D. Dayanand, Dean, Faculty of Allied Health and Basic Sciences, I request Dr. K.J. Malagi, Professor, Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research, to occupy the dais. Thank you, dignitaries. Now, I welcome Dr. C.D. Dayanand, the Dean, Faculty of Allied Health and Basic Sciences of this renowned institution, who works towards connecting young minds to strive towards success and achievements. I request him to give a welcome speech on this occasion. Over to you, sir.
Good morning. Warm greetings to everyone present here today. To begin with, linked to Danvantari Jayanti, let us bow to Danvantari, an avatar of Lord Vishnu, holding in graceful hands a conch shell and a pot of heavenly nectar for our blessings. So let us seek these blessings for sound health of ourselves. Next, under the leadership of our Honorable Vice Chancellor, Dr. Pradeep Kumar, we have commenced an Ayurvedic retreat with Ayurvedic therapies for healing and cleansing at Ayurveda Panchakarma Center at RLJ Alappa Hospital and Research Center. For its more visibility and to see its progress towards success in its future activities, Department of Integrative Medicine today organized a guest lecture on Panchakarma for Wellness. It's a good initiative. To this occasion, on behalf of the Academy and Faculty of Allied Health and Basic Sciences, I welcome our officers in governance, Dr. C.V. Raghuveer, Pro-Chancellor of the Academy. Sir, welcome you, sir. Hearty welcomes to our Honorable Vice Chancellor, Dr. Pradeep Kumar ji. Welcome you, sir. We have with us Dr. P.N. Sriramulu, Principal of Sri Devarajas Medical College and Dean Faculty of Medicine. Sir, hearty welcome to you, sir. So, and we have today's Chief resource person, Dr. S. Prashant, who is the principal of Ayurvedic Mahavidyalaya Hubli. Sir, welcome you, sir. And, yes. As an evidence, Sri Devarajas Academy of Higher Education and Research, through Integrative Medicine Department, entered into a tie-up agreement or memorandum of understanding with Ayurveda Beauty College, Tokyo, Japan, from Ayur Wellness Company Limited. And this company Chief Executive Officer, Mrs. Saki Nikura, is with us. Welcome you, madam. And also, we have our senior professor of Ayurveda, Dr. Malgi sir. Sir, welcome you to this meeting. So, we have with us Masahira Nikura, so husband of our Aki Nikura. Sir, welcome you to Finally, I welcome all the staff, students and invitees to this guest lecture. So, thank you.
Thank you so much, sir, for your warm welcome. On behalf of the gathering, I welcome you to the event section. Now I request all the dignitaries on the dais to join for lighting the lamp to make the event more bright.
Please, you have the honor of lighting the lamp. This one. Thank you. Please do it. Come. Come, sit down. You join me. Ashwin. Yeah, so that will be visible. Sir, cover ಮಾಡಬೇಡ. Please.
Thank you all. Memorandum of Understanding between Sri Devaraja's Academy of Higher Education and Research, Kolar, India, and Ayurveda Beauty College of Tokyo, Japan. As we all know, MOUs help in promoting research activities with students and faculties and also helpful for placements and internships. Department of Integrative Medicine has accepted a MOU with Ayurveda Beauty College, Tokyo, Japan. So let's wish for all good as it helps for Indo-Japan collaboration.
You give me.
Words fall short when you talk about her. She has found a way to be with us despite of the distance and hectic schedules. Let's welcome the woman who played a crucial role in this integration. Mrs. Aki Nikura, CEO, Ayur Wellness Company, Tokyo, Japan. I request Mr. Srinivas M, PhD scholar, Department of Integrative Medicine, to introduce Mrs. Aki Nikura. Over to you, Srinivas.
Thank you, sir. Aki Nikura, President of Ayurveda Beauty College. She is the Director of Ayurveda Association, certified by the Cabinet Office of President. She is the CEO of Ayurveda Wellness Company Limited. She is a lecturer in National Reiki University. She is a master in anti-aging food. She has done an MBA in the University of Wales, Trinity, St. David. 17 years since the establishment of the Ayurveda school in Japan. She has opened an Ayurveda Beauty College in Tokyo and Okinawa to promote the spread of authentic Ayurveda in Japan. Madam owns a Ayurveda farm, Okinawa Prefecture, and awards and achievements. Ayur Wellness Company Limited won the award in the Spa and Wellness category in Japan at the Thar Global Overseas 2021. We welcome you, ma'am.
Hello everyone, namaste. Thank you for having me here. It's very honored to be here myself. Thank you very much, and make it happen to all these university professors, all the people. Thank you very much. I'm sorry, I'm a little nervous, but I was doing Ayurveda school in Japan. I was 17 years. Then actually, once I started Ayurveda was when I overcome with my venial sickness. Then I could able to overcome my by the Ayurveda. So I going to deep into the Ayurveda since then. Then actually I have in Japan has a lot of problem because we have a very longevity people, so we have many issue and social security cost and all that stuff. So what we need is prevent health. So that's we focused on. So Ayurveda is very needed in Japan society. But since then, I'm doing Ayurveda in Japan, but at the same time, we need some evidence and why Ayurveda is so goes well to the people and why. So that's why I really want to know quality of deep Ayurveda science through this university collaboration. That's why all the way come here to meet this collaboration. And also I have an Ayurveda farm in Okinawa prefecture, which is a southern island in Japan. But this Ayurveda farm making a lot of herbs, but I need like a real Ayurveda farm, Ayurveda herbs to cure the Japanese disease as well. And also global relationship between India and Japan is need to be more like stronger in many ways. So I'm going to online course with this university, and at the same time we're going to do the wellness tourism between the students going to exchange each other or taking the classes here. I want to introduce more Indian Ayurveda and the Indian cultures, all that stuff to the Japanese. So I hope in Japan Ayurveda is going to be more regular life that everybody they can take. So as a daily thing, that's why I'm trying to do like a collaboration. So thank you very much for this opportunity. This is my start, the new chapter of my life. Then thank you for accepting me. I'm going to try the best to between this collaboration. Thank you very much.
Thank you, ma'am. He renders selfless services to the institution. He has molded the life of students and served for the well-being of the students. Our Honorable Pro-Chancellor, Dr. C.V. Raghuveer sir, Sri Devaraj Academy of Higher Education and Research, I request him to speak a few words on this occasion. Over please.
Our distinguished Vice Chancellor, Dr. Pradeep Kumar, the guest speaker for today, Dr. Prashant, the principal of the Medical College, Dr. Sriramulu, the Dean of Allied Health and Basic Sciences, Dr. Dayanand, Madam Aki Nikora from Japan, Professor Malgi, Professor of Integrated Medicine, SDUAHER, Mr. Nikora, all my friends in the Basic Sciences and Allied Health Sciences, ladies and gentlemen. I was indeed very happy to know that there was an MOU signed between SDUAHER and the beauty company in Japan. It's a milestone achievement. And all the students and staff of the two faculties, Basic Sciences and Allied Health Sciences, you feel extremely proud that today you have struck a relationship with Japan. Congratulations to all of you. I, in my capacity as the Pro Vice Chancellor at Yenapoya University, Mangalore, was made to look after the Ayush campus for 2 years. I used to go there every day religiously, sit in my office for 5 minutes, then move from room to room of the faculty of the Ayurveda college. Not much about the homeopathy college, but I knew every bit of Ayurveda college. Every staff member in that college remembers me even today, because I went to motivate them, I went to learn from them. I learned a lot. I came to know about Kaya Chikitsa. I came to know about every department in the college. And that gave me a lot of confidence in facing them. One of the departments or one of the branches of Ayurveda, Panchakarma, attracted me a lot. So I got 2 Panchakarma units or 2 Panchakarma theatres open for them. It's very difficult to get Panchakarma, those therapists who come and rub the oil. It's very difficult, it's not easy to get them. They had to come from Kerala to Mangalore to render their service. I had a great opportunity to look after that college, motivate them, and I came to know a lot of things in Ayurveda, a lot of things. So much so that after I retired and came back, I learned that I got 8 patents after my exit. They said it was all because of you, sir, because I used to go to them every day and go behind them to make them achieve this achievement. That is 8 patents. It's not easy to get. There was a girl called Nisha Atikari. She was a dancer also. She was in the pathology department of Ayurveda and she was a dancer. So she had different dance postures for different ways of treatment. And she had created videos after videos. I said all these things are patentable. So we gave her the clue, and she was also she had opened a company with her husband. Husband was also an Ayurvedic physician. She had opened a company with her husband and they were manufacturing analgesic spray. And she presented me with 2 analgesic sprays. They are very effective, extremely effective. So I said, this also you can patent. So she patented that also. So I had a great chance of making the Ayurveda College great by patenting 8 of their staff members' achievements. And then I moved on and I made friends with the principal. He knows me very well even today. Guru Raj is his name. I know him even today. He keeps corresponding with me. And I know all the Ayurvedic physicians, and there is one lady called as Vidyaprabha. She practices in Suratkal. She's doing extremely well. So I keep asking her, what do you give? What do you give? And Panchakarma was explained to me in great detail. It was then I came to know that Ayurveda is not only strives for absence of disease, but it is the state of normalcy of dosha, dhatu, agni and malakriya. It also includes the prasanna atma, soul, indriya, pitta, kapha, which broadly represents the nervous system, the metabolic system and the nutritive system. Keep the human body in balance. Panchakarma is a method of cleansing the body. I don't have to teach the Ayurveda students. I don't know, there are no Ayurveda students as yet. But we are thinking of opening an Ayurveda college under SDUAHER. So Panchakarma is a method of cleansing the body of all the unwanted waste after lubricating it. Panchakarma is in five compartments. Panchakarma treatment is unique in the sense that it includes preventive, curative and promotive actions for various diseases. The 5 karmas are Vamanama, Virechanama, Amuvasana, Nasyam, Ashtapanavasti. I don't have to talk about all that because there are others, experts like Dr. Prashant, who has come all the way from Hubballi to talk about Ayurveda and Panchakarma. I'm very happy indeed, extremely happy, and particularly happy for the integrative medicine department with Malagi as the head of the department and Pradeep as the vice chancellor here to strike a good relationship with the Japanese company. Let me wish this August beginning all the very best. It should not stop at just signing an MOU. It should forge ahead, progress ahead, and in 2 years' time, you should become like what they have become. Let me wish you all the best, and let me thank you for inviting me for talking at this juncture. Thank you very much.
Thank you, sir, for sharing such wonderful experiences. Now I welcome the person who doesn't need any introduction, as he is a well-recognized personality in our institution. Our Honorable Vice Chancellor, Dr. Pradeep Kumar Ji, Sri Devaraja Academy of Higher Education and Research, Kolar. He is known for his wonderful administration and higher achievements of the institution in charge of. I request him to speak a few words on this occasion.
A very good morning, dear friends. My Pro-Chancellor, Professor Raghuveer, Dean, Faculty of Medicine, Dr. Sriramlu, Dean, Faculty of Applied Sciences, Danvantari, and our guest from Japan, Aki Nikura, and Master Hizo Ikura. On behalf of all of us, I would like to say Ohio gozaimasu, which means good morning to you all. Thank you for that. Professor Prashant, Dr. Malagi, and dear friends, it gives me immense pleasure to be associated with this particular event of integrative medicine and association with AWC, that is Oil Wellness Company from Japan. And the key person for this initiative is Professor Malagi, who took the initiative, and Ms. Aki Nikura. I would like to place on thanks the great effort done by both of them in making this happen. So thank you so much for this initiative. Dear friends, I would not like to speak anything about Ayurveda because Professor Raghuveer just not told. For that, another told about the Danvantari God. All I want to tell is, can you make integrative medicine or Panchakarma more evidence-based? Couple of things we use in this process of Panchakarma, like I went for 1 month in SDUAHER, and my wife also underwent a training there. They do these processes of vomiting inducing and induced diarrhea and cleaning of the sinuses with some fluids they call nasha. Somehow I'm not comfortable to invasive procedures, but my wife has gone through these procedures and she feels it gives immense benefit. Now for people, all of us to believe that it gives immense benefit, let us take 1 or 2 areas of this and do evidence-based research in this. For example, nasha, which is supposed to be cleaning the sinuses using some fluid through this nostril and bring out the nostril. Should we not take up few case studies funded by us or through ICMR or Ayush program? If it is believed that this is going to clean sinuses, can we take up cases of chronic sinusitis and are willing to go through this procedure? Request our ENT Professor Prasad or Azim to please be a part of this research and show evidence that this particular process will help in a duration. This sort of studies will give strength to the people in the society. Yes, chronic sinusitis can be done without invasive treatment of perforation of sinuses being treated surgically under anesthesia, but doing this process of Ayurvedic Panchakarma can help. If we can do some such work, now first identify what are these toxins which are going to be cleaned. We should know what are the toxins. If Ayurveda can give us the knowledge of the toxins, the bad elements in the body, either which can be cleaned through vomiting or cleaned through inducing diarrhea or through this sinuses cleaning, we should be able to provide evidence base and probably look for a PhD in this particular program and see that it will give evidence and publish articles, and let the ancient wisdom of our Ayurveda, Danvantari, be brought to the generation next which believe in evidence. We have strongly believed in Western medicine because it gives evidence, it gives results, it gives analysis. Can we take up one such thing? Probably we can think of one product, that is sinusitis as an issue, and conduct a research on that. I will request the Department of Integrative Medicine to please take up one of this challenge. If we can prove this, there will be many more things to come up in the days to come. I am sure Aki will also be able to do this in 2 centers. We can do a similar research here and also in Japan to see this nasha as a therapy to help in sinusitis, give evidence and publish those articles. That will go a long way in the acceptance of Ayurveda, the most oldest treatment in the human history for the benefit of mankind, with less side effects or no side effects. Thank you so much for inviting me for this particular event.
Thank you, sir. We consider you as the reason behind the growth and development of traditional systems of medicine. Thank you once again. I am glad that Dr. K.J. Malagi, Professor, Department of Integrative Medicine, Sri Devaraja's Academy of Higher Education and Research, joined us today. He is a man of virtue and simplicity. He is a living inspiration to the young ones. I request him to introduce our chief guest, Dr. Prashant A.S., Principal of Ayurveda Mahavidyalaya, Hubli, Karnataka. Over to you, sir.
Good morning. Dhanvantare taru dhanvantare bhavasudha bhagvantara vasat manvantara dikrita dhanvantara uttadanide. Respected dignitaries on the dais, today it gives me immense pleasure in introducing my close friend who has done his post-graduation in the field of Ayurveda and PhD in Kaichikitsa and PGMH in sexuality and counseling. Presently, he is working as a principal of Ayurveda Mahavidyalaya, Hubli, and he is a dean of the Faculty of Indian System of Medicine, RGHS, Bangalore. His specialty is in the field of Vata Vyadhi, that is a neurology. And feather in his cap is the students who have excelled not only in India, abroad. So he has guided the post-graduation and the PhD for a number of the students. More than 50 articles have been published in national and international indexed journals. He is a resource person, as a speaker for many of the conferences, and he was a regular resource person in the IR region at the Manipal University, which I was working earlier. And he had an award by Dr. Jayade Memorial Gold Medal and Purudikar Memorial Gold Medal. And as far as the programs are concerned, he has delivered in All India Radio and many TV shows propagating the field of Ayurveda. And he is a member of UOS, PG at RGHS, Bangalore, Chairman BGHS, UG Ayurveda, RGHS, and member of Academic Council, RGHS, and member of PhD Registration Committee, RGHS, member Faculty of Ayurveda, member Board of Studies, KLE, Deemed University, and visited Malaysia for delivering the lectures, invited as a keynote speaker and a featured at Global LLC International Conference held at London. invited a keynote speaker and featured speaker at international conference held at United States of America. Invited a resource and chairperson in the session of international webinar conducted by Darga AMC Maharashtra during 2022. Here I am going to introduce a man with caliber, Dr. Prashant.
Thank you, sir. I request Dr. Prashant sir to speak a few words on this issue.
Today, on behalf of Dhanutrayodashi and Danvantari Jayanti, this prestigious university is observing the National Ayurveda Day event, Har Din Har Ghar Ayurveda. Most respectful, the Honorable Pro Chancellor Dr. C.V. Raghuveer sir, Honorable Vice Chancellor Dr. G. Pradeep Kumar sir, the Dean Dr. C.D. Dayanand, Dr. K.J. Malgi sir, and Mrs. Aki Nikura from Japan, and all the respected delegates. Panchakarma is a subject where this word has been taken by the Guinness Book of World Records. Why? Many number of population use this word in their speech, in their communication. That is Panchakarma. When I was the member in the Central Council of Indian Medicine at New Delhi, we approached the Ministry of Human Resources requesting that our young children of the primary school and higher secondary school should be taught lessons of Ayurveda. If those chapters are introduced, definitely the mothers will learn Ayurveda. Mothers will start educating the whole family with Ayurvedic words. Of course, that is in the primitive stage. If that is introduced, probably that will be a great thing from the government. Ayurveda believes Trivida Chikitsa, that is Nidana Parivarjana, avoidance of the causative factors, Samshamana and Samshodhana, pacification, purification. Purification of the bodily waste elements or the malina padartha, mala, is Shodhana Karma. Pancha Karma, there are 5 major operative procedures. Of course, there are connected other Panchakarma procedures what we believe, like the very famous Shaktikashali Pindasveda, Shirodhara, Kayasekam, peditial, like allied procedure, even Katibasti also. Why they are called as karma? Because these therapeutic procedures with karma kaushalya, skill in the managing different therapeutic procedures are definitely the need of the hour. During the COVID-19, the team of experts at the RGHS, we conducted all India level of the Vice Chancellors meet Then one particular honorable Vice Chancellor is to tell us, he expressed his views, why the whole globe suffered from technical issues and in handling the COVID-19 patients. Mainly, the skills are missing and lacking in the community and in young scholars. They are not trained up properly. So these Panchakarma procedures, if learned properly, wherein the different universities and educational institutions should initiate course curriculum for Panchakarma therapists, massagists and other different areas, when I definitely compliment and congratulate the state government of Kerala, Department of Ayurveda Medical Education, for initiating general nursing and midwifery in Ayurveda, PSC nursing in Ayurveda, B Pharma in Ayurveda, D Pharma in Ayurveda and massage course. And we also try very hard, we are being trying with our Ayush department to introduce all these curriculum and courses at the state government level in Karnataka, and lots of hurdles they are facing. However, why Panchakarma is required? There are various aspects. Rutu Shodhana, in different Rutus and the seasons. For example, in Vasanta Rutu, a person needs to undergo Vamana Karma, Vasante Vamana. Because the winter or the Shishir and Hemant Rutu, accumulated kapha, the phlegm what we call, that is getting liquefied, and that the need where in Vasanta Rutu it should be eliminated through Vamana Karma or therapeutic emesis. This particular Vamana Karma is a very, very effective treatment in Tamaka Shwasa, what is also known as bronchial asthma. Of course, the incidence and morbidity rate of all these asthmatic issues are coming down from the last 3-4 years when people start using masks. And in the Gujarat Ayurveda University, a great research has been conducted at this level by Vamana Karma, mucopolypeptides, immunoglobulins, and the histamines. They are being balanced. In the Vanta Dravya, the vomitus, when it is collected, lots of phospholipids and mucopolypeptides were observed in the vomitus. What is that? Nothing but the dushta kapha or the vitiated phlegm. If that is removed, then a patient is definitely benefited at the level of the tracheobronchial tree, the wheezing and the respiratory distress, along with other symptoms and signs what the patient is suffering from, is being free from that. The oxygen demand is increased. After the Vamana Karma or Shodhana Karma, a person will undergo Rasayana Chikitsa. Then this Pradhana Karma, the major operative procedure, will become Purva Karma, pre-operative for Rasayana. Rasayana is an important branch of Ayurveda in the clinical Ashtanga Ayurveda, wherein the immunomodulants, immunostimulants are administered like Vardhamana Pippali. The Pippali, Piper longum, is given for a prolonged duration in Arohana Matra, that is increasing and tapering dosage. Panchakarma Chikitsa, like Vamana Karma, Virechana Karma, the therapeutic purgation, Nasya Karma, whatever renowned Vice Chancellor and Pro Chancellor spoke about, nasal airings or instilling the medications, oils or ghee or other preparations through the nostrils, where this nasal bridge and nostril orifice is believed as gateway, opening gateway between the brain and nostril. At that level, mucosal secretion from the sinus cavity, and even at the level of the blood-brain barrier, BBB, it is getting absorbed. We have conducted a large sample size study in hepatitis B and other aspects of the jaundice or hepatocellular carcinoma by a drug called as G-Mutaka, Lopha achinata. This particular Lopha species is widely available in Agastyakutam mountains of Kanyakumari near Thiruvananthapuram. Particularly Lopha achinata, Lopha cylindrica, Lopha graveolens, even they are available in the areas like Bajpayee airport near Mangalore. We collected different samples, juices were extracted and patients were instilled through the nostrils these agents. And such a wonderful magic we have noticed. Bilirubin content, which was almost 20 mg, even more than that per deciliter of blood, within 48 hours reduced by 50% by the installation of this nasal urination therapy, what is called Natyakarma or Shiroviration. We have published this article in the international magazine. We have also forwarded this to the British Medical Journal. Now it is a primitive stage of the review. I am very happy that our institution has conducted many research publications, many researchers in postgraduate, PhD as well as in advanced research of RGHS Bangalore. So Nasya Karma with the Shirovilechana, that means cleansing the nasal mucosa. Not only that, from the BBB, bilirubin content which is causing hepatic encephalopathy can be prevented. That's our observation. These kind of purifications are very effective in skin disorders, tvacha rogas. In many of the Vrukagata rogas, renal impairment, wherein the neurovasthi is given nowadays in chronic kidney diseases. Intestinal problems like ulcerative colitis, Crohn's disease, we advise Pichavasthi, Takravasthi, and even irritable bowel syndrome like various areas. Takravasthi is the need of the hour and master remedial therapy. In disorder of the respiratory tract, it is Vamana and Virechana Karma. In Yakratagata Vikara, liver and hepatobiliary disorders, it is Virechana Karma, and other methods like Samsamana or the Anulomana Karma. For Vata dosha, it is Vasti Karma, that is medicated animata in the form Anuvasana, wherein the small dosage of oil or ghee or sneha is given through the rectal orifice. Anuvasana Vasti followed by Niruha Vasti, it is the decoction animata. There are different aspects like giving Chira Vasti, the milk preparations, buttermilk, that is the Takravasti, and also cow's urine is one of the Prakshaka Dravyas. It is added in a little quantity, especially in controlling the lipidemias. In Pitta rogas, when conditions like Visarpa roga, herpes simplex, and other allied conditions, photodermatitis, conditions where maculopapular eruptions, pustules are observed on skin, then in Pittagata Vikara, it is Virechana Karma. For any Kafaja roga, definitely it is Vamana Karma through the oral cavity, the therapeutic emesis is carried out. Rutukalina Shodhana, different seasons are observed, and India and various Asian countries we observe 6 Rutus. Of course, the 6th Rutu component is not there in Australia. It cannot be seen in New Zealand. So in Vasant Rutu, as said before, Vamana Karma. In Sharad Rutu, it is Virechana Karma, and naturally in Grishma and Varsha Rutu, it is Vasti Karma as a preventive measure. Vamana Karma is basically employed in Pratishchaya, means nasal catarrh and nasal congestion. Grana Moolam Stitam Kleshma Marut Admata Shirasa Marutam Chayata Prati iti Pratishchaya. How beautifully Pratishchaya Roga has been defined. Into the nasal cavity, Grana Moolam Stitam Kleshma, in the Grana Bhaga, kapha is getting accumulated, it will not allow the oxygen to enter. So that there is an occlusive phenomenon. To remove that, Vamana karma is employed. Kasaroga, so different kinds of bronchitis in which lots of phlegm is getting accumulated and discharged. Sandra, Bahukafa Nistimana. For example, a child in a pediatric age group will go on getting bronchitis and coughing. And what that will do? Naturally, due to the sweet taste of the phlegm, it will start go on diluting the kapha. And no appetite, mother will bring, my child not eating anything, not drinking anything, because it is eating the phlegm. So there will be guru dharatva, heaviness of the abdomen, so that the cleansing of the abdominal cavity is required. Skin diseases and navajvara. So in the initial conditions of the viral fever, if the Vamana karma is carried out, further its progression can be suppressed in many conditions like psoriasis, eczema, and even, for our surprise, in pemphigus vulgaris and vesiculobilous disorders, Vamana karma is a master therapeutic procedure. Urticaria and the allergic skin rashes. There was an employee working in the syndicate bank. She came to me, give me history that, doctor, nowadays I am having severe discoloration of skin, graphic discoloration of skin with severe itching. Madam, what you are doing? I am working in a bank and almost 25 kilometers I am traveling from my home to the office. My problem is that I am having getting severe vomiting when I am getting into the bus or any transportation. What I do is, I consume some Stametil tablet. I suppress the urge of emesis so that I will be comfortable in the office. When I am back home again during traveling, one more dosage of the Stametil I will consume. For years together, she was suppressing the Vamana Vega. So the suppression of the Chardi Vega leading to Udarda, Shita Pitta, Kota and Utkota, nothing but the urticarial rashes. And in her case, since she was doing and suppressing the wave of the Chardi, because Chardi was a phenomenon, this Vamana and emesis was a phenomenon she was getting during the traveling. That was suppressed by some of the drugs. We started administering Vamana karma by different remedies, especially Vakpatokta, Siddhartha Khanadapta Yoga, and after different sittings, her response was wonderful. So that the T cell count, eosinophilic count, and observed eosinophilic count, even the immunoglobulins which is getting varied, can be rectified and corrected by Vamana karma in many of the allergic manifestations. Now obesity, of course, thyroid-induced obesity, primary thyroidism, subclinical hypothyroidism. In these cases, patient will exhibit the features of kaphaja, naratmanja vikara like tandra, heaviness, gurutva and drowsiness, along with alasya, lots of lethargy and fatigability. In chronic fatigue syndrome, I believe once again Vamana karma is the treatment, even in some of the conditions as a preventive measure like in cardiac problems. Virechana karma, purgation. So the medicine is administered wherein the medicine will deliver and discharge, eliminate waste material through the gut in the form of diarrhea. Water electrolytes are getting discharged. Will we observe water and electrolyte imbalance during Virechana karma? No. If that is properly conducted, if the Snehapan and Puro karma is properly done, then there is no question of electrolyte imbalance during Virechana karma. Virechana has to be conducted with some of the important drugs like Trivut, Nishottara, what we call in Sanskrit. This Trivut is a drug expressed by our authors as anapai, not at all causing any dangerous or any vyapadani. Anapaitvat virechane Trivut Seftamam. That is the statement in Jirnajvara, in chronic fevers, like in viral positive conditions, in intestinal pairs of lubricants, as well as in the pairs of the intestinal villus surface, the salmonella typhi, it is getting accumulated. If the virechana karma is carried out, just like krimivat chikitsa, apakarshana, by that we can see a patient with chronic enteric fever typhoid or a case of carrier phase of enteric fever can be treated, and we have conducted a research in this regard. Other skin disorders, definitely psoriasis and other areas, disease of the spleen, splenomegaly, splenomegaly, splenic disorders, udavarta with udgar pratiti, erectations. Many patients used to come with the non-ulcerative dyspepsia, with conditions like fermented dyspepsia and lots of problem when the food is taken, burp is coming, and even lots of admana or distension of abdomen is taken place. In such conditions, castor oil or the eranda taila preparations, gandharva hasta erandam, nimmamrita erandam, and the eranda taila along with milk or kshira is given. Gandharva hasta, shiravilva, hutasha vishwa, guda gomutra, gukkul yutah, vanner malayo, ruchayo, manashodhanaya. How beautifully the yoga is prepared, formulation is prepared. If you given this yoga, samana vata at the level of the stomach is acting by improving the digestive capacity. And when that goes to the gut, lower aspect of the large intestine, it eliminates the dushta and the accumulated fecal matter. In that way, udavarta roga, burning sensation all over the body like daha, kamala roga. In the rural practice, we see eranda patrasvarasa, the castor oil plant is, and its leaf is getting prepared, the juice is given. In Belgaum city, every Tuesday if you go, a lady, an old woman, she used to give almost a cup of juice. People will be starting just like for kerosene oil or from water near the borewell pump. Why? Hundreds of people are in the queue. Once I stopped my vehicle and a person was telling, a grandmother used to give certain swarasa, that Yerana Patra swarasa for Kamala Roga, nothing but the jaundice. Many kinds of viral arthritis and hepatobiliary disorders, that the master remedy. By giving this Yerana Patra swarasa, there is purgation. Vata Rakta may be vascular pathologies, thromboembolic episodes, varicose veins, and even gouty arthritis. Virechana is a very, very important treatment. In Pakshagata, in hemiplegia, Pakshagate Virechana, thromboembolic episodes, hemorrhagic changes gradually will disappear by giving Gatam Tilvaka Siddhamma, Payasa Eranda Tailena, Pibet Doshaharim Shivam. In Acharya, Charaka Samhita explained regarding the Pakshagata Virechana. In hemiplegia, why Virechana should be given, how the thrombus and embolism can be removed by Virechana karma. So, the bleeding and the clots, they are formed in the middle meningeal artery, in the internal carotid vessel level. But by giving Virechana karma through the gut, it is removed. That is the, again, a miracle. Basti karma, that's how the Basti karma or the enemata is given. Uttara Basti, through the cervical orifice hose, it is administered in females. Nastya karma, through the nostrils, the medications and medicated oil and other preparations are administered. Rakta Mokshana, of course, some of the authors add bloodletting and blood purification, even the vena puncture into the Shodhana karma. Our fellow physicians, some of our fellow physicians and friends, they practice Hirudina medicinalis. Hippocrates, during his time, he called this leech as Hirudina medicinalis. It is having highest medicinal value and many skin problems, crystal-induced arthritis, inflammatory conditions, ulcerations, even gangrene are addressed by bleach therapy. Abhyanga is a part of Panchakarma. It is a prerequisite therapy called as Pura Karma. In the Dinacharya, means in the daily regimen, Abhyangam Acharet Nityam. One has to practice Abhyanga Nityam daily. Shiras Shravana Padeshu Tam Visheshena Chilay. Over the Shirobhaga skull, Shravana, pin of the ear, Hasta and Pada, Mama and plantar aspects, you have to do the Abhyanga, Mardana, Unmardana. These are the various techniques. You need to stimulate these areas because Vata dosha is the seat, it is seated in the skin. Sparshane Vyadiko Vayu, Sparshanam Tattvagatam Adhikam. And by doing Abhyanga, the skin, its luster is getting maintained properly and when we will be having proper tactile sensation. There are different Thaila Yogas mentioned in Ayurveda. One such Thaila Yoga has been recently studied in the Global College, that is at Glasgow, wherein ST Madhu, Glycyrrhiza glabra, has been identified as the beautiful remedy for peripheral neuropathy. Diabetic neuropathy, alcoholic neuropathy, and drug-induced neuropathy. Neurulema sheath damage, and there will be degenerative changes. In such a condition, ST Madhu Sadhita Taila is very, very important. In venous disease, we do the Abhyanga with the Nirgundi Taila or the Karnabhaga. Likewise, according to the disease conditions, different medicated oils are mentioned. They need to be prepared and advised to the patients. Svedana Karma. So after Abhyanga, patient will be getting or he has to undergo perspiration therapy. Why? Sweda has been believed as one of the malas as per Ayurveda. Medo Dhatugata Mala. If there is a proper sweating, a balanced sweating, that is one of the findings of Swasthya. In skin diseases, they are getting occluded. And in many conditions, there will be hyperperspiration. So we need to give the Svedana Karma according to the Bala of the patient and also according to the season, geographical area. There are Valuka Svedas. In tennis and go, we are conducting a mock research trial on 200 populations under RGHS. Valuka Sveda, permutations and combinations. Valuka Sveda, that is the sand, purified sand, along with Rasna Churna, one group, along with Devada Churna, second group, Ashwagandha Churna, and fourth one is along with Bala Churna. One of my PhD scholars, so she has taken this study, Valuka Sveda in tennis elbow. So Valuka Sveda, Istika Sveda in calcaneus spur, Mritika Sveda, Metaphor, and even other kinds of Svedana prakaras are mentioned, they are widely practiced. Dhara. So we are taking Drava Dravyas, means through the liquid media. Many times they are Sukoshna, its temperature is above the body temperature or room temperature. So this Parisheka, Snana Vidhanas, they are carried out in conditions like arthritis, Amavata, Sandhigata Vata, and body aches, Sarvanga Shula. Shirodhara. Hypertension, insomnia, and some of the psychiatric issues. I have published an article in an international journal called as Pijar. You can go through. Myself and my student Dr. Pratibha, we have conducted a clinical trial on Shirodhara. Group A is Takradhara, Group B is Tailadhara, and Group C is Kevala Jaladhara. Here the Kevala Jala, the only Sukoshna Jala, is the standard group. group A and B, they are compared with standard group. Means 150 patients were studied with essential hypertension. Wonderful observations, that is pre-treatment, post-treatment analysis were done and published, one of the fundamental studies. Probably we want to continue the same study at the level of multi-centric level. Shirodhara. Over the Shivalinga, how the Ganga is flowing. Similarly, over the Murdha Bhaga, this Dravadravya, maybe Taila, Shira, Takra, Kashaya and Narikela Jala, etc. are poured. We have designed an electromagnetic Shirodhara Yantra, equally over the right and left side, with the help of some engineering students. An electromagnetic force is done and there is an oscillation from the right to left and left to right. Clockwise and anti-clockwise movement. So this is an advancement in the Shirodhara Yantra. Shirobasti. Here the medicated oil is kept for a prolonged duration. Just like an MBA student, you can observe the photograph here. How during the graduation, during the convocation of the MBA graduate, he or she is put a cap over the head. Similarly, the Shirodhara, the Shirobasti will assemble. In Ardhitaroga, in Bell's palsy, in Pakshagata, in ptosis, conditions like many ophthalmic problems, so they are very useful. Lepam, medicated applications, Churana yogas, they are applied on the inflammatory areas, swellings, painful conditions. Udvartana, so this is again a master treatment. Powder massage. In the management of Udvartana, in the management of obesity, Staulya Roga, in many conditions of increased lipoprotein content, Udvartana, Utsadana, Udgarshana, like various procedures, Udvartanam, Kafaharam, Medasacha, Pravilayanam, Sthirikarana, Manganam, Tvak Prasadana Karam Param. How it is going to become a cosmetic one? Cosmetic procedures. Many yogas like Eladi Churna, Manjistadi Churna, it is applied slowly over the discoloration or the hyperpigmentary areas. So the pigment is getting normalized. Therefore it is Tachya or a cosmetic one. So it is going to improve the complexion of the skin. Similarly, the central obesity and accumulation of fat over different areas of the body. Udvartanam Kafaharam, Nidasacha, Pravilayanam, Sthirikarana Manganam, Tvak Prasadakaram Maram Param. So this particular therapy has been evolved from the Charaka Samhita, Charaka Sutra, Neha Vidhyajaya, Kolam Kulattam Suradar Rasna, Murva Atasi, Taila Falani Kusta, Vatamainam Sagrita Pradeha. That is the basic formula. From there, the Udvartana yogas are developed. Katibasti in lumbar spondylosis, paraspinal spasms, the old name sciatica, lumbar radiculopathies, intervertebral disc prolapse. Taila yogas, Shira yogas, Kashaya yogas are kept for a particular duration. Now there, according to the dosha, if there is a painful condition, Vishagarpa Taila, the name itself Vishagarpa Taila, Dattura metal is the content. Nirgundi Taila. If there is a degenerative condition, Mahamas Taila. And if there is a spasm and a traumatic lesion, then Murivenna oil. So depending upon the situation, the oil and the formula is changed. Katibasti. Grivabasti, from there is one more development and evolution. Katibasti, Shirobasti, then Grivabasti in degenerative cervical disorders. Cervical spondylosis, formation of positive fight over the lateral aspect of the cervical spine with the radiculopathy, giving nutrition to the area. So there are various procedures can be practiced daily as abhyanga, shiroabhyanga, adhabhyanga, udvartana, pratimarshanasya, anjana karma, gandusha, dhupa vidhana and karnapura. Snehana karma, before panchakarma is done, administration of the medicated oil or ghee or medicated media through the oral cavity has to be done. Why? To prevent athiyoga complications. So in snehapana, snehanam, snehavishyandam, madhavam, chedakarakam. After we give a phospholipid content through the oral cavity, we have to do the assessment of the metabolic fire, that is the digestive fire, Agni. We have to do the assessment of the kosta, how the gut is properly functioning, and what should be the dosage. Being it is a prerequisite therapy, dosage followed by duration, and how the medicinal formulation, in which disease condition it should be given. These are the few examples of Sneha Dravya like Danvantari Kritam, mainly in Prameha Roga, or conditions of pre-diabetes, Panchatikta, Gokulu Krita, in dermatological issues, Abhyanga, medicated Thaila yogas and medicated oils, they are administered, they are applied for different parts of the body. So there are various postures, 7 postures: sitting posture, lying posture, supine, lateral, left lateral, and again sitting. So this way the abhyanga should be performed. Shiro abhyanga, migraine headache. I usually suggest my colleagues, why can't you start a headache clinic? Because in Manipur it is there. Or Madagiri sir, when he was head of the department of Ayurveda at Manipur, one program was conducted exclusively on migraine. Many couples used to come to us. That too in the weekend, Friday evening or Saturday morning. And they will be sitting for a prolonged duration, then they will come for consultation. What is your problem? Headache, terrible headache. Why the weekend there is headache? No doctor, headache. So after 2-3 visitations, girl started telling, you go, means the boyfriend, he has to go. Doctor, I want to speak to you something. Why madam, what happened? See, I really nowadays feel that why Saturdays come, why Sundays come, why weekends come. Every week there will be Saturday, every week there will be Sunday. What is the problem with you? No, all 5 days we are very busy in our profession. Maybe it is work from home or online programs and everything. When it is on a Friday evening, my boyfriend will call. I'll go along with him. He will force me for liquors. He will force me for cigarettes. After that, lots of torture is to give. Hence, the headache started. So, its reversal is possible by counseling, sattva chikitsa, and mardana, pranubardhana, nasyakarma, and shiro abhyanga. So, shiro abhyanga is a wonderful therapy here. And we also noticed Monday mornings, after 1 or 2 days holidays over, every Monday by 10 o'clock, terrible headache. And if you record the BP, it is shooting. Why? Avoiding the duties and colleges. So the patients are getting headache due to the stress. Therefore, Abhyanga becomes Roga Anutpadaka, preventive, Dosha Upakramanakaraka, over the dosha, it is going to give results, as well as symptom relief also being benefited. It is Jarahara, aging phenomenon. It is very good for hairs. It is Vatahara, and the visual impairment can be rectified by that. As well, the Marmavigata, traumatic lesions can be managed by Abhyanga Karma. In psychiatric illnesses, Abhyanga followed by Svedana and Vamana Karma. In depression, lots of studies are being conducted on the role of Vamana Karma over depressions. So by taking depression scale, Hamilton scale, the assessment is being performed and made. Virachana. Recently we have taken one more study. Cholelithiasis over gallstones, administering Dantibija, Croton tiglium, along with the Nimburasa, that is Jammira rasa, lemon juice. By giving that, the peristaltic waves are induced, lots of contractions will be there over the gallbladder, and if the size is minimal, around the 3 to 4 mm, it can be discharged through the ampullator. Now, the ongoing studies we are doing over the cholelithiasis. This is how the Virecha Karma is effective and functioning. Vasti, enimata. Through the Pupashya, through the Buddhamarga, through the rectal margin, medicated solution, solvent is administered. Ulcerative colitis is such a condition, usually commonly noticed in traveling population, always eating outside. Whatever is available over the platform in the railway station, over the street food, they will be taking, consuming, and unhygienic food is also one of the reasons to induce Crohn's disease, followed by ulcerative colitis. There will be bleeding per rectum, Pravahika Vatakrita Sashula, Pitta Sadaha, Sa Kafacha, Sa Shonita, Shonita Sambhavacha, Sa Ruksha, Sneha Prabhava Matastu. Our authors describe this particular sequence very well in connection with inflammatory bowel disorders followed by bleeding condition through the rectum in the form of ulcerative colitis. One such formula told in the textbook and practiced widely is Pichavasti. Through the rectal orifice, the Shalmali Niryasa, Shalmalia Malabarica, just like a cotton. Now we collect cotton of that, it is Shalmali Vriksha. From there, the lubricant is extracted and it is administered through the Nirvavasti, and a very useful and effective anti-ulcer agent. It used to heal the ulcerations and prevent the bleeding which is getting discharged per rectum. Along with that, other conditions, other different aspects like Sandhigata Vata, that is osteoarthritis, lumbar spondylosis with the disc degeneration, conditions like gouty arthritis, as well as in vascular problems, the Vasti is widely advised. We have been practicing Vasti in the treatment of Parinama Shula, duodenitis, peptic ulcer and gastric ulcer, Shira Vasti Chikitsa. A patient had come to me with a history of severe vomiting, and when he was examined, there was severe tenderness over the epigastrium. He was a chronic smoker, known for irregular food and also occasional alcoholic. We asked him to get admitted in the ward. Fine. Treatment started with the Snehapan. Slow improvement were noticed. Then Sneha Virechana was given. After that, we advised the Kshiravasti. In between, in the endoscopy, it was noticed endoscopic tube couldn't enter to the second part of the duodenum due to the stricture, and there was a pyloric antrum stenosis. Pyloric antrum stenosis, by the intake is swollen with food start getting regurgitated. Udavarta roga. So on the line of Udavarta roga, Vasti Chikitsa was planned. After Kalavasti, 16 number of Vastis, again the endoscopy was performed. Our great endoscopist from Hubli city, Dr. Supramed sir, he was asked to do the endoscopy. Then he called from the endoscopic area, that is his chamber. Now I can visualize second part of the duodenum. Now no more any stones is existing. That means Vastir Vatecha in Vatajaroga, Vastir Pittecha in Pittajaroga, Vastir Kapecha Sachete. Vastir Ratecha, even Rataja Vikara, Vastir Eva Sadahita. Vastir can be given in multiple conditions with broad spectrum indications. So Vasti in Pakwashagata roga, in urinary problems, in Garbhashagata roga, infertilities, many conditions with oligospermia, NO2 cycle, PCOD, as well as in conditions with musculoskeletal illness like Amavata or polyarthritis. Again, Bhakti is providing nutrition, Brahmana. It is going to prevent purgation, means the recurrent the episodes of the peristaltic waves inducing diarrhea, what we call irritable bowel syndrome, can be controlled. Further, Bhakti can be given to the healthy individuals also. So, how when we pour water to the root of the plant, see how it is growing and the water is going through the xylem and phloem. Similarly, Bhakti Dravya circulates all over the body, and diseases even at the head can be removed, like Pakshagata Roga and even conditions like apasmara or epilepsy. Yapana Bhakti oligospermia. We had a wonderful experience in patients of oligoexternal zoospermias. Coupled with infertility comes with hopelessness. Doctor, can you try something? Yes. Then Bhakti should be the final answer, what I say. So Kshiravasti Vidhana, Yapravasti Vidhana, Maiturajanam, Vikaranam, Visheshato, Kshira Sarpishara Upayogaha Sa Yapanaha, which improve the longevity. And in sexual disorders, Prayoga, administration of Kshira and Grita, medicated milk and ghee is going to improve the volume of the semen. Along with that quantity, also the motility factor can be targeted by this. Grahani Roga, malabsorption, Takravasti, this is an advancement in the Bhakti Karma. This is a recent evolution. How we are giving drip irrigation to the plants in the garden. Similarly, this Takravasti given through the drip method, then there will be slow absorption and the peristaltic waves, recurrent peristaltic waves inducing the diarrhea, dysentery can be controlled. So, Nasya Karma, Shiravachana Karma, when in the medicated powder, ghee, oil or a swarasa juice is instilled to the nasal orifice. This is a gateway into the brain and head. Conditions like Ardhita Roga, deviation of the tongue, increased angulation of the mouth, obliteration of the nasolabial fold with inability to speak. Also, dysarthria, various other speech disorders. I believe Nasya Karma should be the master treatment. Ardetasya mukardeva kevalam tasya tadarditam mukam jimmam jakaroti. So our authors expressed and explained these kinds of disfigurement in a beautiful way. Mukam jimmam karoti sa, and ardite navanam, navan is nasyakarma, nadi sveda upanaham cha. So nadi sveda upanaha and tarpana karma, tarpana chikitsa or the eye bone has to be performed. In facial palsy, in baldness, graying of hairs, in sinusitis, hoarseness of voice, as well as in conditions like tonsillitis, this nasya karma is very effective. We lost one of the great singers of our country, S.P. Balasubramaniam, during COVID first wave. Why? He used to sing continuously without providing any rest to the laryngeal area. One such remedy, what he used to always carry was estimol in his packet. Whenever a singer used to sing very beautifully, the utmost kantya dravya which can stimulate and regulate larynx is estimol, Placericia glabra, Jeshtamadu in Kannada they speak. And our SP, probably he were lived today, our government of India should have declared Bharat Ratna for him. We lost him. He used to undergo nasya karma in between, pratimarsha nasya, because his vocal cord is always overexposed, atiyoga, in our own words we used to say. So this nasya karma, even that can strengthen the voice. Nasya can stimulate the carotid plexus. It also can reduce the headache, and it can stimulate the cortical area. It is the definitive gateway into the cortical system. Regarding Rakta Moksha, the bloodletting therapy, of course, there are various benefits. When the HIV, HBsAg, HCV, like various other infective conditions came to the medical world, very carefully we need to manage the conditions with Rakta Moksha Vidhana, especially the management of varicose veins, deep vein thrombosis, conditions with skin manifestations, dermatitis, this Siraveda, bloodletting, and also Jalukavacharana, leech therapy are wonderful. So the leech application, as I said before, in Scotland, this is one of the general practices. In Scotland, hydroxychloroquine is widely used, and there are a group of physicians treating many conditions through only jalukas. Jala is the water. Jala, Asam, Okam is jaluka. It is living in the water, aquatic organism. Jaluka. Medicinalized. So there is poison, non-poisonous organisms in the classification in the Hirudina group, Hirudina species. So Hirudina medicinalis is Nirvisha. So this Rakta Moksha will purify the waste blood. The impurified blood is removed, especially the crystal-induced arthritis, thrombus formation, and viscosity component of blood is addressed. Viscosity component of the blood, what is that? We speak about a patient is suffering from clot. A patient developed a stroke. Now he will bring a prescription. Doctor, ನೋಡಿ ನಮ್ಮ physician ಬರ್ಕೊಟ್ಟಿದ್ದಾರೆ. Our physician prescribed a drug for ರಕ್ತ ತೆಳುವಾಗಲಿಕ್ಕೆ medicine ಕೊಟ್ಟಿದ್ದಾರೆ. That means what? Viscosity component of the blood is increased. Atorvastatin, like components, acetylsalicylic acid. Similarly, when Jaluka is practiced, same effect is observed. So, Dhara Karma. Dhara Karma of the body, Shirodhara, Sarvanga Dhara, Ekanga Dhara. This is the Shirodhara Yantra. Equilibrium of the brain is made. hypertension, insomnia management. Any patient with the history of severe insomnia, sleeplessness, Nidra has been viewed as one of the Upastambhas. Ahar, Nidra, and Brahmacharya. Every creature in the world has got its own fashion of Nidra and hours of Nidra. So that is Prakritika, that is natural. So if something goes wrong, then our Professor B.M. Hegde sir is to address regarding the Nidra and various resultant phenomena of the Nidra Viparya, insomnia. So insomnia can be treated with the Tailadhara, with the Kshiradhara and Takradhara. This is the Dharapatra advanced developments, and Takradhara, Kshiradhara and Tailadhara in different doshic variations it is performed. After the Panchakarma and Shodhana, patient will be given Rasayana Chikitsa, especially in the systemic lupus erythematosus, autoimmune disorders, and nowadays in cancer. Cancer management, of course, in the management of hepatocellular carcinoma, in the management of CA of breast, as well as in conditions of leukemias. Rasayana Chikitsa has proved by improving the quality of the life, by reducing the side effect of the chemotherapy, by counteracting over the radiotherapy and its side effects. Rasayana therapy can help our patients. A patient had come to me with severe hair loss after radiation. A girl with osteosarcoma, aged about 20 years. Our treatment started with the prayog of the Gugulu Tiktaka, Krita and Bhallataka Rasayana. Bhallataka, Semicarpus anacardium, is a great drug spoken in Ayurveda as Rasayana. Bhallatakani, Tikshnani, Pakini, Agni Samanicha. It is going to improve the metabolism in toto. Kafayo, Nasarogosti, Nakinchit, Bhallatakasama. Cancer and Arbuda Roga, Kranti is due to Kapha, we believe. And when this Bhallataka is given, gradually the hairs what she was losing, there were regenerations. And the treating medical oncologist asked her, have you taken any medicines for your hair loss? She told, yes, my doctor has prescribed Amrita Bhallataka. So this Bhallataka is definitely Amrita. That means Asti Dhatu Agni. We call Kesha, hairs, as the one of the Asti Dhatu. If the Asti Dhatu Agni can be rectified, definitely its Mala, Kesha, Lomadi, Nakhadi can be improved. In that concept, logic, the Bhallataka Rasayana, Amalaka Rasayana, Vardhamana Pipali Rasayana are administered after Panchakarma. So, Rasayana in systemic lupus erythematosus, Rasayana in ulcerative colitis and Raktapitta, Rasayana in skin manifestations like psoriasis, and Rasayana nowadays post-COVID after giving Virechana, Chaunaprasha. Regarding Chaunaprasha, there is a myth and there is a fact. We have conducted a research in collaboration with the pharmacology department of Medical College Trivandrum. It was a wonderful observation. Amalaki cultivated in India per year, annual growth and cultivation of Amalaki, gooseberry. Amalaki exported from India every year, annual exposure. That is the followed by how much Amalaki kalpas are prepared in the market and they are sold. There is no any balance sheet. How much is imported, how much is exported, no imported only. Nothing can be imported because Amalaki is cultivated here in India, zero imported. Then export quality, export products, highest. Marketing, highest. What about the yield? whether in the kalpas, in the formation, real amalaki is added or not, that is the question. So we prescribe, we eat, we consume not some amalaki, whether that is the true amalaki or something is adjoined and adulteration is made. Brahma Rasayana, Agastya Helithic Rasayana, respiratory problems, and great drug, Ashwagandha. Hydroxychloroquine. If there any parallel drug in the natural remedy, I believe that is alone Ashwagandha. If Ashwagandha is given, RBCs, platelet system can be stimulated, and that is Sarvottama, Rasayana and Vajika. So with these findings, Panchakarma, it need to be explored because Government of India from the last 7 years, from 2014 onwards, celebrating and observing National Ayurveda Day on the previous day of Deepavali. It is believed by us that Lord Danvantari got avatar during the Samudra Mantana Kalam that same day. But there is also one more opinion. In the Dhanur Masa, Danvantari Jayanti is also observed. However, once I was traveling to Geneva for a meet in WHO, along with one of the esteemed medical scientists called as Dr. S.G. Nagaroti, former medical director of KIMS. It was so wonderful event and experience for me. A delegate was asking Dr. Nagaroti, what India has given. He is a medical expert with the MD, MRCP from UK, that is Glasgow, in pathology, renowned pathologist. Then his answer was very simple, that is Ayurveda. What India has given to the world, and his answer was very simple, that was Ayurveda. Being a modern scientist, he was promoting Ayurveda in WHO meeting. So I congratulate, compliment the Department of Integrative Medicine for taking up all these challenges, and definitely Lord Danvantari will be blessing throughout this institution, because there is Krishna, our sir, Krishna J. Badagi is there. He is Dwapara Yuga, now to the Kali Yuga, our Krishna has come to Devaraj Institute of Medical Science. Thank you everybody.
Thank you, sir, for an insightful talk on Ayurveda with evidences and your life experiences as an Ayurveda physician. Thank you once again. Now, I request any questions? Thank you. Now I request our dignitaries to felicitate Dr. Prashant. Thank you, dignitaries. Now I request our dignitaries to felicitate Mrs. Aki Nikura. Thank you, dignitaries. Thank you, Dr. Prashant, and thank you, Dr. Mrs. Akili Pura. Your presence made the day. Now, I welcome Dr. Dhanashri Patil, whose perspective on life makes us live more thoughtfully. I request Dr. Dhanashri to give a vote of thanks. Over to you, ma'am.
Warm and cherished morning to everyone. It's my privilege to propose vote of thanks. First and foremost, I thank our chief guest, Dr. Prashant A.S. Sir, Principal of Ayurveda Mahavidyalaya Hubli, to being the catalyst that inspired as a pillar of power by your motivational words about the Ayurveda practice. A special mention to our special guest, Akili Pura, of signing a MOU with our institution. With deep sense of appreciation, we thank you, ma'am, and looking forward for more collaborative activities with our I thank our Honorable Chancellor, Sri G.S. Nagarajaji, and other members of the management for their continued support and encouragement. I thank our Pro-Chancellor, Dr. C.V. Raghuvi, for his support. I am grateful to Dr. G. Pradeep Kumar, our Honorable Vice Chancellor, for his constant support and encouragement and being here with us. We thank you all. A hearty thanks to Dr. Divyalan Prasad sir, who is the registrar of our institution, and Dr. Sri Ramlu PN, Principal and Dean of Medicine, Dr. C.T. Dayanand, Dean Allied Health and Basic Sciences, for their valuable guidance and always being there as a pillar of support. We thank you, sir. A hearty thanks to the faculties of the Department of Integrative Medicine and Allied Health Sciences for organizing and taking effort to conduct this program. A special thank to each one of you for sparing your time and being a part of today's program. Without you all, it would be not have been so effective. I thank you all the students and faculties for their active participation. I also thank all the people who helped us in organizing this event directly or indirectly. Once again, a special thanks to each one of you. Thank you.
I once again convey my gratitude to all who have joined us today. Thank you very much. All can have drinks outside.